we had a troll come after us. They said that I did postpartum wrong because apparently there's only one way that you're supposed to do it. So in this video, I'm going to be sharing what I did wrong during my postpartum that has destroyed my experience, apparently. And we're going to share the story. We're going to share the story of the troll that came after MamasteFit. My name is Gina. I'm a perinatal fitness trainer and birth doula and currently a mom of 4. So I thought that I knew how to do postpartum because I thought I was so experienced, but I did it all wrong.
Apparently. Fourth time is not the charm for Gina. I'm Roxanne. I'm a labor and delivery nurse and student midwife, and I've had 3 kids. And I definitely have learned a lot of things about postpartum after my first not great experience.
So I had somebody that reshared my postpartum experience reels as an example of what is wrong with society. And when we confronted her about it, she said that she wasn't attacking me. She was attacking the culture. That made me think that this is how I needed to do
culture.
The culture is what made me think I needed to do it this way, apparently. So what had happened was after 2 weeks of primarily resting in bed with tons of support from my mom, my husband, and Roxanne, I decided to get out of bed and start moving around my house and go to my book launch, which was at right around 3 weeks postpartum. In addition to going to the book launch, my husband also went on a short work trip. And so I took all 4 of my kids to the park by myself
For like 45 minutes.
which ruined my postpartum, apparently.
And that's why Gina is just riddled with anxiety.
And so the troll said that because I didn't rest in bed for 6 weeks is why I have a normal amount of anxiety. And if only I had rested, it's just 42 days. For those 6 weeks, I would have no anxiety or mental health issues.
Your community should have supported you more to be able to rest in bed without getting out of bed
For 6
weeks.
So we're going to discuss why this mindset is, one, incredibly problematic, and should you really be resting in bed for 6 full weeks? We're going to talk about where does this notion even come from? Is that actually healthy for you? And can being super supported in every aspect of your life be realistic in the postpartum? We're going to discuss. So I do want to start with our disclaimer because this is what this lady was promoting. Well, she was promoting a meal plan. If you buy my meal plan, you'll have no mental health issues, which we both know that's already not true. Is her claim was if I had just rested in bed for 6 weeks, I ate this perfect diet, and I had tons of support from everyone in my life, I would not have any mental health issues. That is not
Anxiety.
true. That is not true. You can have so much support. You can eat incredibly nourishing food. You can have a great birth experience and do a great amount of rest after birth and still struggle mentally. For me, in my second postpartum, which was an amazing birth experience, I had tons of support from our family. I was eating really good food. Like I was pretty much living with our mom at that time. I struggled the most mentally after that one with postpartum anxiety and OCD, probably because I had a lot of prenatal anxiety. And so this notion that if you check all these boxes, things will be perfect for you is incredibly frustrating and not true. In addition, if somebody doesn't check all these perfect boxes, or even if they do, if they struggle mentally, they may feel ashamed to ask for help because they already did a bunch of stuff wrong. They didn't do postpartum perfect, or they did do postpartum perfect and they're still struggling. Well, what's wrong with them? And so that mindset is incredibly problematic, which is why we blasted her on our Instagram page because it's inappropriate to, one, attack a newly postpartum mom saying that she did everything wrong
for their anxiety.
Yeah, rude. So rude. So what is this 42 or 6 week lying in period? And should you really be resting in bed that entire time? Is that healthy for you? So this 40 days of rest after birth comes from East Asian cultures and even some Hispanic cultures where there is a period of time after birth where the mother is kind of kept in the home. She just kind of snuggles and bonds with her baby as everyone else kind of does stuff for her. So Roxanne and I are half Korean. Our mom is originally from South Korea. And so this is a common practice, or at least it used to be in South Korea, where there was a confinement period after birth where you would just primarily rest as everyone kind of waits on you. However, within this 40-day period, you are not immobile in bed. It's like a week or two in bed, And then you start getting up and moving, typically around the time that your bleeding starts to decrease, which is an interesting notion that this troll did not take into account. In most of the East Asian cultures, or the cultures that have this kind of confinement or quarantine period after birth, usually around the week or 2 mark, moms are encouraged to get up and start moving around the home. Now, they're not going out of the home and doing all their normal errands. They're not going to the gym and working out. They're just starting to increase movement as their bodies continue to heal in the postpartum.
The reason why the first 1 to 2 weeks for resting is beneficial is that placenta was attached to your uterus on that uterine lining. And when it detaches, those blood vessels are still open and almost a scab forms. A lot of people will say like, oh, it's like a dinner-sized plate wound within your uterus. That's not necessarily true, that's how big your wound is within your uterus, because your uterus is shrinking, so that wound is getting smaller as it shrinks. But there is still an open wound within your uterus where that placenta was attached, and that needs to go through that tissue healing process, which can take about 1 to 2 weeks. This scab that, like, even if you scraped your knee on the ground, you have that little scab, and that scab has to fall off, usually like 7 to 14 days after you scraped your knee. The same thing with the scab within your uterus. It will come off between 7 to 14 days, depending on the person, and that will increase the bleeding, but then that wound has like kind of finished that initial healing process, and that coincides with the 1 to 2 weeks of healing to allow that placenta wound to fully heal and give your pelvic floor a chance to recover from pregnancy and birth.
So I'm a fan of taking your time postpartum to allow your body to gradually heal. And this is going to extend beyond that 40-day timeline as well. It's not just as soon as you get the 6 weeks all clear, just do everything like you did before. It's still a very gradual process, probably for the first year postpartum as your tissues are continuing to heal, because we were pregnant for 9 to 10 months. And so it would be understandable that it's probably going to take at least 9 to 10 months to really heal and recover from pregnancy. Now, what we recommend in the early timeframe postpartum, and this will vary depending on what type of support you have available or what is realistic for you as a person, and whether
As well
or not,
as your birth
and also like
experience.
whether or not you want to. Because at the end of the day, we're all individuals, and we get to decide what works best for us and for our family without some random person telling you that you did everything wrong and because you did it this way is why you have problems that you don't actually have. Like I don't have problems with anxiety. I have a normal amount of anxiety. And so what we recommend is the 5-5-5. And this can vary depending on like who is giving the recommendation. For some, it's 5 days in the bed where you're just off your feet and you're just laying down in the bed. And then it's 5 days on the bed where you're in a little bit more upright of a position. And then it's 5 days near the bed. So essentially 15 days around your bed. I find that it's 5 days on the bed, so you're primarily off your feet. It's 5 days around the bed or around your home, so we're starting to increase some of that movement. And then 5 days like slowly venturing outside your house is what I found to be more realistic for me. But this time frame can also change, again, depending on your birth experience. What is going on with your life circumstances? So this is a very general time frame, but essentially what we're looking for is in the first 1 to 2 weeks postpartum, we're primarily off our feet, allowing the tissue to heal. At this point of the tissue healing timeline, we're in the inflammation phase. And so there's a lot of blood flow, a lot of swelling, and we're trying to begin that initial healing process. And offloading the tissue can be really beneficial. And so what we primarily want to do is be off our feet as much as possible. Now, what can you do if you don't have the support, though, to not be on your feet, to not be taking care of older children? As much as you can is we can try to be off our feet in like a seated position, lying down if you can. It can be a little bit harder if you have toddlers. And also wearing supportive garments just to provide a little bit of support for the perineum and for the pelvic floor in those early days. After you've spent the first phase of tissue healing primarily off your feet, we do want to start loading the tissue. And so this is what's going to be really beneficial to establishing the density of your tissue as it begins to heal. And so this is going to be primarily from days like 7 to 21 to 28. So the next like 3-ish weeks postpartum. Now, this tissue that's starting to form during this next phase of tissue healing is not super strong. And so it's similar like when you sprain your ankle, you have like a few days of swelling and then you usually feel pretty good. And so you go back to the gym and you do all your normal stuff and then you re-injure it again. It's because that tissue that was healing was not super strong yet. That's in like the next phase of tissue healing that happens around that 21 to 28 day mark. And so during this phase, this is when we're going for those slow walks. We're maybe integrating a little bit like light exercise, like super gentle, nothing super crazy at this point, to begin to gently load this tissue as it heals. But it is important to load the tissue because that's what's going to help make it stronger when we make it to the next phase of tissue healing. And so during this time frame, what I was doing was going for some really short walks, like 10 to 15 minutes, doing some gentle mobility, and then some really light core exercises just to begin to reintegrate movement into my body, but still super light. And so the days where I went to my book launch, I took my children to the park. I didn't go for a walk that day because that was my movement for the day. And so you are allowed to leave your home at any point in the postpartum period. You don't have to confine yourself to your house if that doesn't work best for you. For me, at that 10-day mark, I needed to get out of my house. I felt I was starting to get cabin fever. And so for my own mental health, it was not good for me to just lay in that bed for 6 full weeks. And so to tell somebody that because they only did 2 weeks of resting in bed and they didn't do the full 6 is why they have mental health problems. And so for me personally, resting in bed beyond that 2-week period would not have been great for my own mental health.
It's also important, like we were saying, our birth experience also plays a part in our postpartum recovery process. Gina had a low risk intervention, a home birth, vaginal birth. She didn't tear. So all of these things went into effect of how she was able to move around during her postpartum because she didn't have a laceration that was healing that might take 1 to 2 weeks, where she would need to lay down maybe a little bit more just from discomfort. Whereas I had a postpartum hemorrhage. So me getting out of bed at 2 weeks postpartum, I got lightheaded just walking to the bathroom. So taking into account your birth experience in this timeline is so important, and knowing that we are all individuals for our postpartum experience. So one person's experience doesn't mean that you need to do it this way as well. So if you had something go on during your birth process, and you're like, well, I can't get up and go for a walk at 10 days postpartum because I don't feel ready, that's fine. There are different things that we can look for to say whether or not we're ready to go on these walks or go on adding in gentle mobility or gentle movement throughout our day. And this is a really good indicator of how ready you are to, get back to fitness as well. So if you're wanting to add in activity, and it's these gentle walks, if your bleeding has slowed down to where maybe you only need to wear a panty liner, it's not that heavy bleeding anymore, being mindful of what is your bleeding doing after you do those activities. So if your bleeding has slowed down and now you went for this walk and your bleeding picks right back up, that would be a sign that it was a little too early, or maybe that walk was a little too long. Other things that you might not notice to look for if maybe your bleeding is fine, but now you suddenly feel really, really the chills, really hot or really cold, like you have the flu or something, body aches, as well as you just feel like you can't get warm. This is another sign that your body did too much too soon because it's focusing on other things, and that we need to, again, rest in bed for a day and then try again another day. If you start feeling extra heaviness within our pelvic floor, this is usually within those first 6 weeks, not due to prolapse or your organs falling out. It's more likely due to pelvic floor tension because you're doing too much and your pelvic floor is just I need to tense up and prevent these organs from falling out. And you may be doing this subconsciously. Sometimes I find myself doing the same thing, especially within those first 6 weeks postpartum, that I was probably on my feet for a little bit too long. And I felt my pelvic floor just tensing up because I subconsciously, I'm I do have prolapse and I would like my organs not to fall out of my vagina. But our pelvic floor just pushed a baby, had to move out of the way for a baby to come through it. It needs to recover, and it can't immediately go for a 45-minute walk or do a lot of movement, and it will start to feel heavy because it's getting tired after a certain period of time. So those indicators are a really great way to tell whether or not you can go on these longer walks or start doing more mobility. If you are maybe 10 days postpartum and your bleeding is good, you're not getting these crazy chills at night, and your pelvic floor feels great, then you are probably good to go and do all of those things. If you feel lightheaded when you walk to the bathroom, going for a 15-minute walk postpartum is probably not ideal. If your bleeding increases after you walk to the kitchen in your house, probably not beneficial to go for a walk. if you have pelvic floor heaviness from just lifting up your child, maybe not ready to add in some exercise into your life just yet at like 2 weeks postpartum. So taking all of these other things into account, it's never just like a timeline of like 555, you're good to go. Great. Life can go on, or 42 days, even though you're still bleeding at 42 days, like you're good, 6 weeks is up, have a good day, or you're still having pain at 6 weeks. Oh, well, the timeline is up. That's what this book says. That's not like the narrative that we're pushing. It's more like, listen to our bodies. And some of our bodies are ready at 10 days to incorporate activities. Some people's bodies need more time. So those are some really great tips. I think the thing with the troll that kind of triggered her the most was, one, you shared a reel about intrusive thoughts and said that they're normal, which they are. We have a whole podcast episode with some psychologists who specialize in postpartum and perinatal time frame, and they said intrusive thoughts are normal. It's when they affect our life that they become a problem, which they did not affect Gina's life. They're just normal thoughts that we're trying to stay safe. But because Gina also left her house at 3 weeks and then she had intrusive thoughts, she's like, you're normalizing anxiety.
I am not. It is not.
You did postpartum wrong and now you have anxiety.
Like, are you surprised that you have it now when you did all those things? And so as Roxanne was saying, it's important to note that each of our postpartums is an individual experience based on so many different circumstances, to include what was our birth like, what was our pregnancy like, how many children do you have, how much support do you have? Like, it's unrealistic to tell everyone to do things in this one specific way because, one, not everybody wants to do it that way, and two, not everyone has the life circumstances to do it in that way. And so when we imply that you do it any other way, you're wrong, it's really harmful. And that narrative is not beneficial for really anybody. And so as we navigate the postpartum, we're taking our time kind of moving through these different phases. At first, we do really want to try to rest in bed. That time frame may vary from person to person. For me, 10 days felt really good to just be off my feet laying in bed. And after that, I felt pretty good to begin kind of moving around my house, starting to go for really short walks. But it was very, very mild, not my normal level of activity. It wasn't like 2 weeks back to what I was doing
Gina
before.
wasn't thrusting 75 pounds.
It was 2 weeks and then like slowly starting to venture out my house a little bit more. So slowly starting to go for these short walks. But my level of activity was still much lower. And even now at 7 weeks postpartum, I have started to reincorporate workouts and structured exercise into my daily routine, but it's still very mild compared to pre-pregnancy. I am not lifting barbells in super heavy weight yet. I'm still primarily doing body weight movements with bands, very low volume. Like, I'm gradually building up, and this is going to be a year-long process. Recovering from birth all the way to kind of returning to pre-pregnancy levels of activity is going to be a year-long process. And so while you may see short clips of my life and those trolls that want to come after us, know that just because you saw this tiny clip of my life and you want to make a really bold assumption on how it is that I'm doing things, you can be rest assured that I am taking my time to recover in the postpartum based on what I have decided as an adult works best for me. If you would like more support during your pregnancy and your postpartum so that you can do it perfectly like us, know that we support you choosing whatever works best for you. So that is how we can support you. We understand that not everybody has the same life circumstances, and also not everybody wants to do things the way that we do it or can do it in the way that we do it. And so we fully acknowledge that you are an adult and that you can make decisions on what works best for you and your family, and we fully support them. So if you enjoyed this video, be sure to subscribe to our channels to get notified whenever we release new videos. We release educational videos throughout the week, in addition to sharing about our own personal experience as mothers of, between the two of us, 7 children. If you want to check out our online courses, we offer fitness programs in addition to online childbirth education and postpartum education courses. So you can learn more from us and use code YouTube10 to get 10% off anything that we offer.